IFCT is the French collaborative intergroup dedicated to the study of lung cancer. And in this LORLATU study, we looked at patients who received Lorlatinib, third generation ALK-ROS1 inhibitor, part of the expanded access program. So we are looking at patients with ALK-positive or ROS1-positive non-small cell lung cancer in a large cohort of patients, heavily pretreated. The mean number of previous line was 4 in this cohort of patients, at least for the ALK-positive patients. We confirmed the results of the phase 2 study, which was a multi-arm phase 2 study that showed the benefit of Lorlatinib after the failure of first, second, or sequence of first or second ALK tyrosine kinase inhibitors. The results in terms of efficacy show a median overall survival of 8 to 12 months, which is in line with what was previously reported. So the key point is that the strategy, at least for the patient with ALK-positive non-small cell lung cancer, is switching with the results of the Crohn trial that demonstrated the benefit of Lorlatinib versus crizotinib in the first-line setting. So the key question is, what is the sequencing of TKIs in ALK-positive tumors? Should we do a sequence of second-generation inhibitor first line followed by Lorlatinib and maybe subsequent chemotherapy and maybe a re-challenge with the TKI? Or should we start with Lorlatinib upfront? We do not have the responses right now. We need more follow-up in the Crohn trial, but the results seems to be promising. So other point is that we probably would need a comparison between Lorlatinib and a second generation inhibitor in the first line setting, but such trial does not exist. So the last point is that for the clinic, the management of ALK-positive non-small cell lung cancer is actually complex because we need to have the first objective of controlling the disease and having a tumor response, which is an immediate objective for the patient to reduce the tumor burden and the symptoms. But we also have to envision the long term and what will be the subsequent therapies, because unfortunately we know that the efficacy of TKIs at some point disappears. So, and at the end, from the real world data that we have, we know that the median overall survival of those patients may be prolonged up to 7-8 years from the historical data with the sequencing of TKI. So it's very important to have a discussion at each step of the management of the patients to choose the best option.